Okay, so look, the title of the article is Efficacy and Safety of Neuroplastogen TSND 201 for the Treatment of PTSD. So PTSD, as I'm sure many of you know, is post-traumatic stress disorder. This is a psychiatric disorder that generally occurs in response to an event that was, either threatening to your life or your safety or threatening to the life or safety of another. That creates this, that going forward creates this sort of trauma response where you get flashbacks, you get panic attacks, difficulty sleeping. This could be a very difficult thing to treat. Currently treatment guidelines for PTSD, recommend certain kinds of therapy like EMDR therapy, cognitive behavioral therapy. And there are, a host of medications that we kind of use um, uh, for the treatment of the symptoms. No, those are mostly in the SSRI class, so like the antidepressant class. I believe Zoloft is the only one approved for PTSD. And in the trials that it studied Zoloft and its function of PTSD, it was better than placebo, though the response was not incredibly robust. And in clinical practice, I can tell you that it's very rare that a single antidepressant actually manages all the symptoms of PTSD. It can be quite complex to manage. So any kind of novel therapy to treat a difficult to treat condition is exciting news. What I find most exciting about this, though, and most intriguing, is this neuroplastogen, which I'll be honest, I don't know what a neuroplastogen is. I had to look this up. What is TSND 201? So TSND 201 is actually something called methylone. And if that sounds familiar to you, that's because it's one of the ingredients found in bath salts. So I don't know if you guys remembered in the 2010s, there was this crazy phase of people taking bath salts to get high. If you go to any head shop, where they sell, tobacco pipes or fake marijuana, it'll always be awash in recreational drugs that have just not gotten regulated yet. That's a game in the recreational drug world, right? Like if ecstasy is illegal, well, you synthesize something that looks like ecstasy but isn't, and thus it's not regulated and it's legal. And so that's what the game was with bath salts. People were, I guess, abusing this, and some of them having psychiatric breakdowns. I think there were even some deaths related to it. In Miami, when I went to medical school, there was actually a famous case where somebody who appeared intoxicated approached a random person and literally bit his face off. And the assumption everyone made was bath salts. So basically, it was a foregone conclusion in everyone's mind. As it turned out, the only thing in the system was marijuana, which was odd. I guess maybe the guy was just hungry. But suffice it to say, bath salts have been a drug of abuse amongst people trying to skirt the law for some time. So it's really interesting to see it show up for a potential clinical use, right? How the medication works, it works on the brain to release some of the neurotransmitter and hormones that help regulate mood and anxiety. So things like serotonin, norepinephrine, and dopamine. Apparently, according to the article, it does not bind to the serotonergic receptor that would cause hallucinations. So it's not a hallucinogen, apparently, though it does appear to have some potential abuse potential rather, because it does kind of release dopamine, which creates euphoria. And obviously people were using it for a reason when they were using it recreationally. So I think they were looking at this medication or substance or whatever you want to call it from a biochemical perspective, saying, hey, it releases these important hormones and neurotransmitters. Perhaps we could use this in the treatment of PTSD. So, I mean, this trial is a phase 2 clinical trial. So it's a small trial, basically to get a prelim look at the effectiveness and the safety of this novel compound. Suffice to say, it was a pretty successful trial. There was a significant reduction in PTSD symptoms. There was a significant number of study participants who actually lost the diagnosis of PTSD while on this medication. And the medication seemed to work quicker than we would get with SSRIs. SSRIs generally take at least 3 weeks to start seeing any kind of meaningful benefit, whereas we started seeing response in this medication as soon as a week. So at least in this small trial, it seems that there is a more robust response to bath salts than there are to our current FDA-approved pharmaceuticals, and it seems to work more rapidly than we would get with our standard therapies. Okay, in terms of side effects, this medication, it does have some side effects, more that were seen more than in the placebo group. So they're like things like headaches and nausea, decreased appetite. But in terms of serious outcomes, no one bit anyone's faces off. There was, no homicides. There was actually someone who reported suicidal ideation about 6 days after discontinuing the medication, but none during the treatment trial. So again, this is a small trial. I believe there was only about 60 or 70 participants overall in the trial. Again, preliminary data on safety certainly looks like it's relatively well tolerated, meaning we're not seeing, major events like heart attacks, psychiatric hospitalizations, suicides. But we are seeing a signal for some minor adverse side effects, and that one episode of suicidal ideation. Given that it's a relatively small cohort, I think obviously would deserve more scrutiny, which is what will eventually happen when this medication, I'm sure, will go to a phase 3 clinical trial, which will enroll much larger groups. And when you have a larger population, it helps to determine whether these kind of, one-offs you're seeing, like in the case of suicidal ideation, whether that was just an anomaly based on, just a small cohort and it happened to happen, or if, in a larger cohort, we start to see this pattern more and more, and we start to realize that there is this link between suicidal ideation and this bath salt. But obviously, that remains to be seen. We'll need phase 3 clinical trials, obviously, just for the medication to get approval. Big picture, I do find this exciting. Anytime there is a medication to treat a psychiatric condition that has promise, I'm excited. And that's just because the reality is most psychiatric conditions are quite difficult to treat. I treat a fair number. And what I can tell you is when it comes to things like treatment-resistant depression, PTSD, schizophrenia, there's not a lot of tools in our arsenal, and there are a number of medications, but only a handful of classes of medications to treat these conditions. And the response rates are generally not great. For things like depression, it can be a coin flip when someone takes an antidepressant. Any drug that comes in that shows, perhaps a novel mechanism for treating it for, those patients who have not been successful in other treatments, and perhaps a more robust and a more rapid response does absolutely seem promising. I think there's a number of other kind of medications that are in the same vein as the bath salts that are coming to our social conscious, right? Like we've obviously, because of Matthew, is it Matthew Perry from Friends? I think that's his name. Matthew Perry's death. There was a lot of interest in ketamine for treating treatment-resistant depression, although I'm sure their stock fell after he died. Rest in peace, not to make fun of the dead. And there's also a lot of kind of exciting small clinical trials looking at things like psilocybin, which is found in magic mushrooms for people with treatment-resistant depression. All the studies that have been conducted with these kind of potential drugs of abuse in treating psychiatric conditions have been small studies. We don't have any wide-scale studies, but at least in the short term, those studies also showed promising effects. Right? Basically, it looks like they could potentially be used in patients that have tried other things and failed, and potentially even be used in people that have, an acute, severe episode of depression to get them stabilize faster. So I think there's obviously this need and a demand for better psychiatric medication. So I'm absolutely, excited about anything that comes up that has this, that has that potential. Now, obviously there's potential downsides in that. I don't know that much about bath salts and methadone, but clearly there's probably going to be, an abuse potential. I don't know how great that potential is. I'd be interested to learn more. I'm guessing if and when this medication gets approved, it will be a controlled substance, so that'll have its own kind of hurdles. And and when it comes to prescribing controlled medicines, from the perspective of the doctors and the medical systems, that is its own kind of can of worms, because you always have to be judicious in how you prescribe because, most people who come to you for treatment are really just coming to you for what they're asking for on face value. They're feeling depressed. They want something to help with the depression. They're struggling with their focus. They're there for something for their focus. They're not there to abuse drugs. But I think because of the onus that's put on us to make sure that we're prescribing controlled medications judiciously, and the fact that there's like databases with all our prescribing patterns, I could see some hesitancy and some skepticism among doctors when people come to their offices asking for bath salts for their PTSD symptoms. And then there's also like a whole other can of worms, which is like, what is PTSD? From the perspective of a predominantly medical doctor, meaning someone who's not a specialist in psychiatry, oftentimes people come in already with the PTSD doses and we don't PTSD diagnosis, and we don't know how they got it. And oftentimes if you probe into the diagnosis, you'll see that the diagnosis is questionable. For example, I'll have someone say they're suffering PTSD, and I'll ask them what's about their symptoms and what prompted the symptoms to start. And it'll be something like, I had a boss who was really mean or something. Is that truly PTSD? I wouldn't say so because, again, PTSD is sort of predicated on you being in a position where you feel helpless and there's a threat. I guess you could potentially see that with, something like negative workplace interactions, though I've never diagnosed someone with PTSD based on those kind of reports. Though I'm not an expert on PTSD, and if there are experts listening who want to correct me, I'm happy to be corrected. But yeah, there would come this question, just like with ADHD, with the popularity of ADHD and the potential for abuse. A lot of people come in with ADHD symptoms, and again, it's up to the doctor to determine, like, is this really ADHD? Is it caused by something else? Are they just trying to game me? Are they selling these things? So it leads into all these kind of interesting ethical questions. And I think it also comes down to a lot of your view of how you view people, right? If you see patients largely as, a population that's out to scam you and get over on you, which does happen in cases of burnouts, obviously you're going to be super skeptical, bath salts being prescribed for PTSD. No, I think if you perhaps come from a place where you're not so jaded and kind of see people for what they are, which is they're just like you. When they come to you asking for something, it probably is just what they're saying. Then I think perhaps this is of more interest. But I do think it's a really fascinating topic, and I'll be checking my news feeds for more on this topic.